Welcome back. In this video, I'll teach you everything that you need to know about supraventricular tachycardia. I'll teach you how to read the ECG, how to know the symptoms, and how to treat the patients. Supraventricular tachycardia is caused by supraventricular issues, so the atria, and this issue causes the ventricles to be contracting rapidly. So tachycardia. So think of any atrial issues that causes the ventricles to contract faster. In the ECG, it looks almost identical to the sinus tachycardia. So you will see all the QRS complexes basically identical, and they are exactly the same distance apart. And it can be very difficult to distinguish from actual sinus tachycardia. The most common cause is electrical heart diseases, and it makes sense because the electrical current starts from the atria. Also atrial flutter or atrial fibrillation, some stimulants that increases the heart rate like caffeine, stress in some patients, electrolyte disturbances especially for potassium because it has a very narrow window, and some general illnesses like fever because it naturally increases the heart rate. Expect the patient to have fatigue with dizziness, shortness of breath because the heart is pumping ineffectively, weakness, and tiredness. The most effective treatment is eliminating this tachycardia, and this can be quickly done by the carotid massage. And if the issue still persists, we can try some medications like the calcium channel blockers, especially verapamil. It is important to look for the cause after you treat the acute condition of the patient. So after eliminating the supraventricular tachycardia, you should look elsewhere in the body to know what causes this condition in the first place. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.